stained with the hemoglobin. So the pleura, the parietal pleura that you're seeing is kind of pinkish. But what is this vessel right behind the pleura? I'm just going to kind of open it up. What is that big vessel? Because some people might want to think that's inferior. See how, look at where it courses. It's coursing up here, and it's joining. If we take away the pleura here, or these actually mesenteries in the, look at where that big blue, it doesn't look so blue, but it's big blue, and it's joining this, what was this structure again right here? Ah, what other vein joins the superior vena cava, folks? Remember this one I mentioned? And then it comes from there, that little opening right there. Remember the azygos vein?
Yeah.
Oh, you now remember. So the azygos vein will only be visible when you're looking at the very posterior aspect of the thoracic cavity, not when you're looking between a lung and the heart, the left lung and the heart. Actually, right, sorry, because the azygos vein is only on the right. There's not a similar structure over here on the left.
So it's just one.
The little hemiazygos on the left eventually crosses the midline to join the azygos vein. So okay, just so that's pretty much above the diaphragm. Then quickly below the diaphragm, to get below the diaphragm, folks, we went and we just cut the little tail of the diaphragm. And for this huge, vast dome of the diaphragm called, which is skeletal muscle, its origin is really, really small. It's called the tail. There's a right and a left half to this domed structure. And remember the hiatus of the diaphragm right in between. So we, and this already had done there had been a very good job done of cutting that little tail, which are the forceps there. Here, I like these great big ones.
That's a kidney.
So here's, and I'm going to turn this where the light's a little better, not a lot. I wish that light fixture were right over the end here. But so see that little tail? You can just see it right there. I just severed it right. Just that's how wide it is, and yet it gives rise to that full expanse on the left. Okay, so the red pin is marking the celiac trunk. Do you see that's the very first? Can we see we can see the aorta pretty clearly. Can you see that Cecilia? Everything's in front of it, but there's the celiac trunk. I'm going to get that kidney to stay back there. So there's the celiac trunk, and what happens to the celiac trunk, folks? It gives rise to three vessels, one of which is the splenic, which if I sort of wiggle the spleen here, you can sort of see, well, there's the splenic. And this other one's heading all the way over here to the liver, and so there's the hepatic. It's actually called some people call it the proper hepatic and some the common hepatic, because as soon as it gets to the liver, it branches into right and left hepatic arteries. So common or proper. And then the other one is the left gastric. And we won't, I really don't ask really any of those except maybe the splenic, because you can actually see it. You can actually see it heading right up here to the spleen. See how if you were to clean that up and follow it, you can see it heading there. Actually, this is all the splenic, because these are little branches. So we'd have to look for like the common hepatic. We'd have to go down in here and see there's another little branch coming off right down here. But we won't worry about the trifurcation. We'll know for theory what happens to the celiac trunk. And I'll only ask you celiac trunk probably. So then.
Probably after.
Well, because once in a while, folks, when you're doing hepatic portal system, and in this case, see, you can clearly see your splenic vein is this yellow thing coming from the spleen. Sometimes you can actually see the splenic artery running right with it. So that, like I say, when you have other clear anatomical landmarks, very good, then that's fair game. But when it's not so clear, like here, then in this context, I'd only ask, from this view or whatever, I'd only ask celiac trunk. Okay. Do we see how quickly, in this case, in this cat, folks, it's almost, this is an anatomical variation, but doesn't it appear to you that the superior mesenteric artery comes off at the exact same location as the celiac trunk? See how there's almost like a common arisal? Usually there's a little bit of a pause on the aorta between the celiac trunk coming off and the superior mesenteric, but these are individual variations. So I'm going to go out on a limb and say this is quite unusual to see because this splenic artery is just superior mesenteric artery. I don't know what's wrong with my mouth today. I'm thinking the right thing, but I'm not saying it. So anyway, in this case, it almost looks like you have one common arisal off the aorta, but there should be two distinct ones. And in most every other cat, you're going to see not a long separation between the two. There's quick succession of the celiac trunk and then the superior mesenteric artery. But in this case, they're just right together. So, but we can clearly see that they diverge in terms of their path. And how do I know that's superior mesenteric? Because when I wiggle all of the mesentery, see how that vessel wiggles. Can you see? It's dark, but can you see that okay, Cecilia? So there's the superior mesenteric artery distributing to all of this, the mesentery. Yeah. So then, back on the aorta again, and the next two vessels that come off are paired because they're the renals, and to actually see the aorta, it's awkward to see the aorta, but boy, it's dark. So what we're doing is we birthed out the kidney, and there's its little adipose capsule. You know, you can see the fascia. There's the parietal peritoneum over it. That is parietal peritoneum right there.
There's another kidney on the...
Right. Well, this is just the left kidney, but the renal vessels are paired because one renal artery goes to the right kidney and one to the left. And this one has a fair amount of sort of adipose. But there is the renal artery right there. See how I'm around posterior? But you can see the kind of the reddish tinge to it right here. Yeah? And if you follow that back, if you go all the way back, you'll be able to see that it does indeed come off this structure called the aorta. And the aorta is retroperitoneal as well. But so see, can everybody see that? I'm going to put this little blunt probe around the renal artery, and do you see where it actually comes off the aorta there? We're looking at the aorta sort of from behind here. Yeah, can you see that okay, Katie? And then for you folks, you got to look way in there. But here's the aorta right along here. Here's the renal artery. When I push this back in situ in its normal position, we can clearly see the renal vein, this blue structure, going back to the IVC, but we kind of don't see the renal artery. Yeah? Okay, so then we're back on the aorta again, and this aorta gives rise, in this case, to a lone male. So here's testicular arteries, which unfortunately, fortunately you can see the whole artery here, but it got severed. See the little origin, and there it is right there. Came off because there's the aorta. And there was the left testicular artery. The right testicular artery, fortunately, is still intact. There it is. That little red, and it's coming off somewhere. No, here, sorry, it's right here, sorry, I was way too high. This green is the testicular artery. See how it came, and there's the aorta. See how the right one got cut right there. I don't know if you can zoom in, you can actually see the cut end of the right testicular artery. This is the left testicular artery, and here's the right, but you can see the coursing of the right down through the inguinal ring. It'll go through this anterior wall of and then see there's the spermatic cord, and you can actually trace that down into the scrotum. So you can trace that all the way down, which we'll do with reproductive system. So those are the testiculars, and then last but not least is the inferior mesenteric artery, which unfortunately, because see how the posterior parietal wall got ripped, and there is the inferior mesenteric artery right here. Oh, it's all wrapped around here. Let me get this pin out of here. Well, actually, no, it didn't. Actually, it's right here. Well, what was the one that was severed? Oh, or maybe it was just wrapped around. Oh, cool. There it is. See, we're back on the aorta again here. And here's the inferior mesenteric artery. How do I know that? Because it's supplying the mesocolon. That's its whole distribution in all the little branches it gives off. Yeah? And then back on the aorta again, and pretty soon, boom, what happens to the aorta here and here?
It bifurcates.
Into what two vessels?
The right and left iliac.
Common
iliac arteries.
Right and left common iliac arteries. Now, in the cat, folks, there's this big third trifurcation, but we're not even going to go there.
That's for the tail, right?
Their internal iliac arteries come off as the hypogastric and then branch and go because of the tail and so forth. So we're just going to track with these two because this is how it is in humans. Humans do have a hypogastric, a little, but it just goes into the pelvis. So now let's follow each of our common iliac arteries, and again, because it's different in the cat, but let's say it was the human, the common iliac arteries wouldn't run very long before they end into a small branch and a large branch. The small branch stays inside the pelvis and is called the internal iliac artery, because it stays internal to the pelvis. And the larger branch is called the external iliac artery because it externalizes by continuing on forward. So we're just going to kind of somewhere between common iliac here and then the top of the thigh. I wouldn't trick you guys. I probably couldn't ask external iliac in the cat just because it's hard to know exactly where. But then that same vessel, once it's in the thigh, it's now called the
femoral
artery. Very good. And we know what happens to the femoral. Stays deep, 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 goes around behind the knee, which you rarely see this in the cat because the injection, they just don't push latex that hard. Around the popliteal region becomes anterior and posterior tibial. And then we just know that gives rise to the plantar arches and the digitals, and we're not going to micromanage that a whole lot. So any questions so far? Anything that comes?
It's a lot of memorization.
So it's a lot of, but you know what? If you put together your knowledge of body rhythms and the understanding of really what are blood vessels, they're just like freeways. They really, for the most part, they don't go anywhere. They're just a means of conveyance. Like when you go to Seattle, you say, "Oh, I get on I-5," but how many people stay on I-5? I mean, they just drive it to get to some exit. And that's really all you're doing. If you can remember that all these are conduits that are passing, and then most of them are just named for the region they pass through. Once in a while there's a difference.
The common iliac, there's a right and a left, right?
Of
And
course.
then each right and the left has an external, each one
Absolutely, absolutely. So the aorta, because now how many lower extremities do we have? We have two.
Okay.
So you have to, that's probably the single hardest thing why people think it's hard, because we're bilaterally symmetrical, so there's a right and left of everything. Except for the very few places where, as you know, there's only one brachiocephalic trunk. We're not as symmetrical as